I mean, rather than sit here and say they ought to do this, they ought to do that, I'm going to do it. So just give us a call. You have to get through Mr. Call Screener. You got to be concise because there's going to be a lot of you. But all this crap about how wonderful this damn program is, even before it's implemented, it's going to cover millions and millions of people. Yes, it's dropping millions and millions of people from the health care they like. Now, I want to remind you of what our great president said, who is in fact a serial liar. I want to remind you what he said about Obamacare. And I want to also tell you today he made 2 public statements about this, a 10-minute speech, also a comment in front of his cabinet, and he wouldn't take a single question. No questions, because that's the way imperial presidents are. Number 7, Mr. Producer. Here's Obama, May 11th, 2009, cut 7, go.
But I'm also committed to ensuring that whatever plan we design upholds 3 basic principles. First, the rising costs of health care must be brought down.
Lie.
Second, Americans must have the freedom to keep whatever doctor and health care plan they have.
Lie.
Or to choose a new doctor or health care plan if they want it.
Lie.
And third, all Americans must have quality, affordable health care.
Lie again. 4 lies in 2 sentences. Here's Obama, August 15, 2009, cut 8, go.
No matter what you've heard, if you like your doctor or health care plan, you can keep it.
Lie.
If you don't have insurance, you'll finally be able to afford
Lie.
insurance. And everyone will have the security and stability that's missing today.
Lie. Obama, March 23, 2010. Cut 9, go.
If you like your current insurance, you will keep your current insurance. No government takeover. Nobody's changing what you've got if you're happy with it.
Bald face lies. Cut 10, Obama, September 10, 2009, go.
If you are among the hundreds of millions of Americans who already have health insurance through your job, or Medicare, or Medicaid, or the VA, nothing in this plan will require you or your employer to change the coverage of the doctor.
Liar.
Let me repeat this. Nothing in our plan requires you to change what you have.
Now you know why I call him a serial liar. Obama, February 19, 2008, cut 11, go.
And if you already have health insurance, we will lower your premiums by $2,500 per
Lie.
family per year. And if you can't afford it, we will subsidize your care, and we will emphasize prevention so we have a health care system instead of a disease care system.
Lie. Obama, December 16, 2009, cut 12, go.
If we don't pass it, here's the guarantee. Your premiums will go up. Your employers are going to load up more costs on you. Potentially, they're going to drop your coverage because they just can't afford an increase of 25-30% in terms of the cost of providing health care to employees each and every year.
I guess they can now.
And the federal government will go bankrupt because Medicare and Medicaid are on a trajectory that are unsustainable.
Stop. What has Obama done about Medicare and Medicaid? Medicaid, he's massively expanded, and Medicare, he's undoing.
This actually provides us the best chance of starting to bend the cost curve on the government expenditures of Medicare and Medicaid. So anybody who says that they are concerned about the deficit, concerned about debt, concerned about loading up taxes on future generations, you have to be supportive of this health care bill, because if you don't do this, nobody...
All right, lies. Now, cut 13, Obama, April 13, 2011, go.
Our approach lowers the government's health care bills by reducing the cost of health care itself. Already the reforms we passed in the health care law will reduce our deficit by $1 trillion.
Absolute flat-out lie. I've got the statistics right here. If I have time, I'm going to get to them. Obama, September 10, 2009, cut 14, go.
The plan will not add to our deficit. The middle class will realize greater security, not higher taxes. And if we are able to slow the growth of health care costs by just 0.1% each year.
All right, and you didn't.
%. It will actually reduce the deficit by...
Cut 15, Obama, March 3, 2010, go.
My proposal would bring down the cost of health care for millions. Families, businesses, and the federal government. Our cost-cutting measures mirror most of the proposals...
That's enough. Now, folks, he lied repeatedly about Obamacare, just as today he lied repeatedly about his own role in the debt, in yearly deficits, in conspiring with Harry Reid to make sure we don't have budgets. Obama's willing to say anything because that's what he was taught. That's what he was taught by Davis, by Ayers, by Wright, Saul Alinsky's readings and so forth. Say whatever you have to say, particularly with the Praetorian media in this country, which stands there and guards you, protects you from the truth. Now I want you to hear some of the truth, ladies and gentlemen. Greg, Fort Myers, Florida, the great WFSX. What is Obamacare doing to you? Go.
Well, Mark, my wife and I spent the last 15 years building a medical transcription company, and we had it up to 132 employees. And within months of that bill being signed, we're down to 5. So 15 years of hard work just down the drain. And
how did Obamacare do that?
Well, there's a system. They want to connect all of the hospital records together. So they, the way I understand it is, they didn't tell them they had to use the system, but if they didn't use it, they wouldn't get Medicare and Medicaid reimbursements. So hospitals all across the nation spent hundreds of millions of dollars implementing this new system, and it took away the medical transcription, put tens of thousands of people out of work. And from what I understand, it's not working the way they wanted it to. Doctors hate it, hospitals hate it.
And what is medical transcription, briefly? I'm sorry.
Well, that's where a doctor, when he examines you, he dictates into a recorder, and then he has somebody transcribe it.
And keeps the records to himself in his office for possible sharing if you need a specialist or you're in the hospital, but not some part of a federal database.
Right.
All right.
It was supposed to be a federal database, but that's not working. I mean, it could have been with the system they had. Everything was on computers anyway. They just needed to tie them together. But I don't know.
So 127 people have lost their jobs in your business, your small business, as a result of this.
Yes, sir. Yeah.
All right. Thank you for your call, sir. I'm sorry. Robin, Concord, California, the great KSFO. What has Obamacare done to you? Go.
I got my notice on Saturday from Blue Shield. My premiums for the next year are going up $2,000. Not only that, my plan was canceled. They're putting me on a different plan. All I wanted was catastrophic insurance. Next year I will have to pay almost $6,200. I'm a single woman. I'm self-employed, and I carry my own insurance. And as of next month, I'm going to have to cancel it.
Isn't it amazing? The government has destroyed what was perfectly fine for you.
Exactly, Mark. I will never again be able to save for retirement. I will never again be able to do any major maintenance on my home. They're destroying my life, Mark.
All right, Robin, I'm very sorry. And they don't give a crap either. Brian, Reading, Pennsylvania, Sirius Satellite, what has Obamacare done to you?
Hey there, Mark. I help run a grocery store up there, and I'll tell you what, all of our employees' hours have gotten cut below 28 hours, and, you know, these are people that depend on our job to support their families, and now people are getting 2 to 3 jobs, performance issues, and employee morale is entirely too low. We're running into issues with high turnover because people aren't getting the hours. Now we have to hire more employees, and you're seeing hours cut down to 16, 17 hours a week, so it's not even worth their time. And, it puts a huge, huge stress on management to try and cover those positions and try to get even people hours to, make them happy to stay.
Isn't it amazing? And meanwhile, all the propagandists dressed up as journalists all over television and radio talking about millions of people will now have health care when, in fact, people are losing their jobs, full-time jobs to part-time, losing jobs, losing their health care benefits. I mean, the media propaganda, which is trying to hold up Obama, is unbelievable, is it not?
Oh, look, I absolutely agree with you. I mean, a lot of these people are people with no kind of, business reality where they look at things and say, well, you know what, this is for the better, nothing's going to happen. But, us who are trying to run stores, run businesses, see it as such a destructive policy. And what do we tell our employees? They don't want to believe that, Obama and his great administration are doing this. They want to look at the corporation now and say, oh, well, you know what? They just don't want us to get the hours. They don't want to pay us. And that's entirely not the fact. But none of them want to look into it and know the truth.
All right, Brian, thank you for your call. I'm sorry to hear this. Heather, Wisconsin, Sirius Satellite, go.
We're self-employed farmers, and I have a husband and 2 young children. Our premiums since the Affordable Care Act have gone up 100% per month, and our deductible has gone up 50%.
Mm-hmm.
That's it.
And why? Why? Because, the government's stepping in between you and your policies, driving up costs. Do you know what's actually going on here, Heather, and nobody's talking about it? This is a major scam. This is about redistributing wealth. And so money is being taken from you and these other folks who are calling, whether they're small business people, the other lady who called, the single woman who called. It's being taken from you. It's being laundered through the federal government, laundered through state exchanges, and going to somebody else.
I've had my policy for so long, I actually received a letter from the insurance company saying some of the rules for Obamacare won't apply to your policy, so you should feel lucky. But in the meantime, they still jacked it up 100%.
Mm-hmm.
So I don't know whether that's
Heather.
good or bad. I still don't know what's all going to happen. But
here's the thing. The people who passed this damn law, and the man who signed it, and the jerk on the Supreme Court who rewrote the Constitution, they don't know. They have no idea. This is how tyranny works. This isn't a constitutional republic. Thank you for your call, Heather. This is a disgrace, and we actually have people in Congress right now defending this, and they don't even know what the hell they're defending, except for the fact it takes decision-making away from you and screws up your life and gives it to them. That much they know. The question is, for those of you who care to share your views and call the program, and we have a full board, but keep them coming. The question is, what has Obamacare done to you as a patient or a doctor or some other type of provider, as a nurse, as a consumer generally, employee, employer, union, non-union? I can tell you right now, CNN and MSNBC, I don't even think Fox, have cameras out there across the country asking people what a disaster this is. And folks are all over the place who are being ruined by this. And I mean ruined. It's all over. It's right in front of your face. But somehow the cameras can't find you. But I've asked you to call in if you have an Obamacare story, because we need to counter all this propaganda that's coming out of the White House, coming out of the Democrat Party, and, of course, coming out of their media. And so what better place to do that than here? Wait around for the RNC to run commercials? Those damn fools. Oh, by the way, they haven't gotten back to us on, hey, we want Mark to moderate some of our debates. They never were going to, folks. That was a ruse. Chris, Indianapolis, Indiana, the great WFDM. Go.
Great to talk to you, Mark. Big fan.
Thank you.
My wife and I are both photographers. We run a small business. Our premiums went up about 25%, which ends up being about $3,000. That was in January. And I was told that in a year they're going up another 25%, so that's an insane rise. So I looked into getting into a photographers group, basically like a nationwide group of a big pool of photographers to buy health insurance. And apparently I'm not going to be able to do that anymore either. And I got a kid on the way in about a month. I'm not sure what I'm going to be able to do because there's no possible way I can afford to pay for the new insurance premium.
You know what they're doing, Chris? They're cutting off every avenue to competitive health care. They're cutting it off. They're cutting group insurance, individual insurance, employer insurance. They're just cutting it off, and they're pushing us like a bunch of cattle into government care here.
I don't want government care.
None of us do.
All right,
and thank you. You're welcome. And clearly the people in Congress and the president doesn't want it either. Yes, they're in the government. Yes, but we're paying for it. Pam, Dallas, Texas, the great WBAP. Quickly, go.
God bless you, Mark. Yes, my husband and I are retired. Last February, we got notification from our insurance that as of January 1st, 2014, our premiums were going up 85%.
Holy
My
man.
husband is ill. This is even if we can keep our insurance, because we're anticipating they are going to deny him the critical care that he needs. We worked our whole life to set up our retirement, to be sure that we had appropriate health care. We educated our kids. We were responsible, and it's being stolen from us now by
You're exactly right. You're exact, Pam. I'm sorry. Thank you for your call. Folks, I'll tell you what. Stay on the line. We're going to continue. Somebody has to do this. It might as well be me. I'll be right back. I mean, look at this. The Daily Caller. Here are the 10 states where consumers may like their health care plans, but they won't be able to keep them. And there are other states, too, but they pointed out these 10. California, 58,000 will lose their plans under Obamacare. 58,000. Aetna, the country's third largest insurer, left first in July, followed by United Health. Anthem Blue Cross pulled out of California's Obamacare exchange for small businesses as well. 54% of Californians expect to lose their coverage, according to an August poll. Missouri, patients of the state's largest hospital system, which spans 13 hospitals, including the St. Louis Children's Hospital, will not be covered by the largest insurer on Obamacare exchanges, Anthem Blue Cross Blue Shield. Anthem covers 79,000 patients in Missouri who may seek subsidies on Obamacare's exchanges, but won't be able to see any doctors in the BJC healthcare system. Just look how people's lives are being ruined. If we're not going to shut the government down over this, what are we going to do? Go along with it? Connecticut. Aetna, the third largest insurer in the nation, won't offer insurance on the Obamacare exchange in its home state, or it was founded in 1850. Why? Because they say we believe the modification to the rates filed by Aetna will not allow us to collect enough premiums to cover the cost of the plans and meet the service expectations of our customers, said a spokesman. Maryland, 13,000 individuals covered by Aetna and its recently purchased Coventry Healthcare won't be able to keep their insurance plans if they want Obamacare subsidies on the exchanges. South Carolina, 28,000 people were insured by Medical Mutual of Ohio, the second largest insurance company in that state, until it decided to leave entirely in July due to Obamacare's, quote, vast and quite complex, unquote, new regulations. New York. Aetna pulled out of New York's exchange in late August in an effort to keep their plans, quote, financially viable, unquote. New Jersey, where your goofball governor, expanding Medicaid, has supported Obamacare in action by refusing to oppose it in briefs. 1.1 million Aetna customers are at risk in New Jersey, where the leading insurer also won't be a part of the exchange. 2,600 patients purchase individual plans with the company, that's all. But any looking to take advantage of subsidies on the exchange won't be able to do so. But 1.1 million of you in New Jersey at risk. Iowa, Wellmark, Blue Cross, and Blue Shield, Iowa's largest health insurer, decided not to offer plans in the Obamacare exchange. It sells 86% of Iowa's individual health insurance plans. Wisconsin, 2 of the 3 largest insurers in the state won't offer plans on the exchange. United Healthcare and Humana patients will have to get a new health insurance insurer to buy insurance on Obamacare exchanges. And in Georgia, just 5 insurers are participating in Georgia's Obamacare exchange. Medical Mutual of Ohio left Georgia and Indiana, as well as South Carolina, due to Obamacare regulations. Aetna, along with Coventry, also decided against participating in the Georgia healthcare system. So rather than more choices, less choices, both in terms of insurance companies and insurance policies. And yet you're required to have health insurance. In other words, you're required to get government-mandated health insurance where the government either writes the policy for the private insurance company to the extent you still have private insurance, or you go on state exchanges, again, where the private insurance companies are required to offer certain benefits and deny certain benefits. Meanwhile, the price is skyrocketing for many, many people in the so-called middle class. Also, George Mason's University Mercatus Center, Charles Bleyhouse, Obamacare, signed in 2010, will significantly worsen the federal government's fiscal position relative to previous law between now and 2021. That's only 7.5 years from now. Obamacare is expected to add as much as $530 billion to the federal deficit while increasing spending by more than $1.15 trillion. Remember, Obama said it would cut $1 trillion. Despite the fondest hope from its supporters, they write, the passage of Obamacare unambiguously darkens a dim fiscal future. So in addition to so many of you, it's disastrous for the government generally, which is us. Then listen to this one from Market Watch. Diana Fergot Roth. I can't read it all, but parts of it. Obamacare is partly responsible for the slow jobs recovery if employers with 50 or more employees do not offer the right kind of health insurance and at least one employee gets subsidized coverage on the exchange. They're faced with penalties of $2,000 per employee per year. Since the first 30 workers are exempt from the penalty, moving from 49 to 50 workers can cost an employer $40,000 a year. Also, companies can get around the penalty, as you know, by hiring part-time workers because they do not owe the $2,000 penalty on those workers who work fewer than 30 hours a week. And many, many, many employers are doing that. Small, large, medium-sized, every industry. SeaWorld, Walmart, Land's End, substituting part-time for full-time workers. McDonald's is begging that this law be changed for the sake of its employees. The Internal Revenue Service estimates that family plans will cost $20,000 in after-tax dollars by 2016. Anyone under 400% of the poverty line, currently $94,000 for a family of four, qualifies for a subsidy unless a family member has employer-provided insurance. And she goes on to explain how this law promotes divorce. She says, perversely, the only way for other family members to get subsidized coverage would be for the spouses to get divorced. Then the spouse without coverage and the children could get coverage on the exchange. In other words, what's happening is, because of the perverse disincentives under Obamacare, you have a married couple with children. Let's say the husband works for the company. The wife works for somebody else or is a stay-at-home mom with the kids and so forth. Company says, okay, we're going to cover our employee. Well, what about the family? We're not covering them. Why? Because our insurance costs are going through the roof. So here's one area where we can limit our exposure. And this is happening all over the country. And Obama said, oh, the fear-mongering, all the stories, don't blow $1 billion an hour. It's nothing to do with advertising. And it's not fear-mongering if it's true. And this isn't even being covered by the nightly news. You're listening to the news programs on this program, which I have no control over. And most of them, the ones I can hear anyway, which is not all of them, they don't even talk about this. Instead, they talk about the game that's going on in Washington. Or they quote the idiot governor of New Jersey. This shows a failure on everybody's part. Oh, good for you, Governor. Suggest everybody go along with it. Just go along with it, right? And I love these people. I talked about this a couple of weeks ago. Hey, it's going to implode of its own weight. Just let it go in place. Let it get in place. Do you hear the people calling this program? This has real life consequences. And then they say, what does Obamacare have to do with the continuing resolution? It funds Obamacare. We want a clean bill. It's the law. The lawless citing the law. Now, isn't that precious? Isn't that precious? Now, I promised I'd get to some of you callers because I said, you folks who are affected by Obamacare, you're not getting the media's attention. Springfield, Missouri, the great KSGF. Go.
Hey, Mark. Thanks for taking my call.
Yes, sir.
A couple of quick comments. One is I'm a veteran, and I am quite tired of hearing how we are victims in this fight for our liberties.
Well, you know, Mike, that's the only way Obama views you folks, as victims.
You know, of all the groups in society, the veterans are the ones that have given the most. And you know as well as I do that there is no money in the services. I mean, you don't go into the Army, you don't go in the Navy for money. You go in there because there's a core value of protecting, you know, some would say freedom, but really it is liberty as a whole. Mm-hmm. And I'm tired of, as a veteran, hearing how someone might not get a paycheck for a couple of weeks. These are guys that have, you know, trudged around in the desert or swamps or places we don't even know about, and going without a paycheck for a couple of weeks is well worth the cost.
Well, you know, Mike, I appreciate that, and I'll tell you something else. This is a man, Obama, who came up with a sequester idea where 50% of the cuts would come out of the military, when the military doesn't even make up 50% of the budget, not even close. So he wanted to punish the men and women in the military through the sequester, and he has punished them. And also, as you know, he is unilaterally disarming us, in my view, in a significant way by trying to hollow out the military. So these are all crocodile tears on his part.
I agree. And on the insurance side, I'm out of the service now, but I work in a factory, and we literally sat around a table with our whiteboard trying to figure out how we were going to come up with insurance coverage for our workers, and wound up increasing our deductibles to an outrageous amount. And the amount of our increase, my increase, not the initial base, but the increase, is $3,000 a year. And
it's amazing.
The company absorbed that also. So it was like a $6,000 increase over what we already
paid. And for
paid.
what? For what? Nothing's changed. He talks about you can have your insurance if you want it, you can have your policy. Flat out lie.
And worse than that, it actually got worse because the coverage that we were able to buy for that got worse.
Yeah.
We had to raise deductibles, we had to change office call visits, those kind of things. So really, it's a lot worse insurance. And it's not as bad for me because I'm a professional, but for the average guy that has 4 or 5 kids who doesn't make but $30,000 a year, there's just no way.
So why isn't CNN interviewing any of these people, or MSNBC? Fox is barely doing it. NBC, ABC, CBS, whatever the hell else is out there. I mean, they're not making a story out of this, and it's widespread, and it's everywhere.
And one last thing, and I know you got a lot of callers, but one last thing on that point, because it doesn't fit the model, and the model is a socialist environment where we all put in and we all take out, but, it's a poor quote, but
I got to go, Mike. Thanks for your service. But how many people have died by the aggressive socialist model we call Marxism? Because they just didn't fit into the plan. They just didn't fit into the model. An awful lot, one way or another. I'll be right back. Obama concerned about shutting down the government. As I said earlier, he wants to shut down the government, and he wants to continue Obamacare. And the American people don't want Obamacare, and they don't want the government shut down. But his Praetorian Guard media help him get his word out, his message out, which is full of lies. Now, let's go to, cut 19, Mr. Producer, Obama Today. Go.
Unfortunately, right now, House Republicans continue to tie funding of the government to ideological demands like limiting a woman's access to contraception.
Stop. This is abortion again, I guess. He can't stop it. He's obsessed with abortion. And once again, I say, if you have problem getting contraceptives, then there's something wrong with you. Because every pharmacy makes them available. And there's a lot of pharmacies. Every supermarket with a pharmacy makes them available. I'm tired of the President of the United States acting like such an idiot because he thinks we're all idiots. Go ahead.
Delaying the Affordable Care Act, all to save face after making some impossible promises to the extreme right wing of their party.
All right, the extreme right wing of their party. That's us. Because we've had enough of this from our Marxist president who followed Saul Alinsky and Bill Ayers and Jeremiah Wright and a large number of miscreants and malcontents. We do not embrace his alien ideology. And once again, I want to repeat what I've said here many times and what I've written about. We're not ideological. We're conservatives. Conservatism is a way of life. It's a way of thinking. It's not an ideology like a secular religion. That's the utopian statists, as I've written about at such length. Conservatism, fundamentally, is based on human experience, what works and what doesn't work. Conservatism is based on the notion of God-given natural rights and natural law, not man-made rights that could be taken at any time. Conservatism believes in a just and stable law and judicial system, not judicial activism. We can't predict all outcomes, and we don't choose to. We believe in individual sovereignty. People will make decisions that are smart and make decisions that are dumb. We also believe that man is imperfect, and his institutions are imperfect. Unlike Obama, who says he will talk to anybody but won't allow any changes to his Obamacare, which is a disaster before it's even left the gate. So we are not ideological. We're conservatives. And I've been pressing the case for what people now call constitutional conservatism. People, fiscal, social. I press the case for constitutional conservatism. I'm probably the first and most outspoken individual who promotes it. because it means something. It matters. Even the phrase constitutional conservatism, I didn't invent it, but it certainly was unique. It wasn't really popularized until liberty and tyranny. And so when the President of the United States calls tens of millions of Americans extremists, extreme right wing of their party, and one of his hacks is on CNN talking about strapping bombs to our chests, and so you realize how unstable they are and how off they are and how radical they are. Our radical agenda. See, we're not trying to take anybody's health care away. Obama is. We're not trying to destroy job creation in this nation. Obama is. We're not trying to take somebody's wealth. Obama is. We're not trying to evade the Constitution. Obama is. We don't reject the notion of unalienable rights and substitute them with government-mandated rights. Obama does. We don't believe that there's a perfect utopia out there, but Obama does. And we certainly don't seek to fundamentally transform America. Obama does. And Obamacare contributes to that. Why should any Republican vote to support this? Why should any Republican vote for the suicide of his own nation? And that's what we're talking about here. And why should any conservative tolerate any Republican who does? Oh, you're moderate, you see. You're a moderate like Pete King. You've had enough of this stuff. Go ahead, fund the government. That is, fund every aspect of it. Obamacare, support the massive debt, the suicide of the nation. That's what Pete King supports. And Michael Grimes or Grims, whatever the hell the backbencher's name is, and all the rest of the so-called moderates, there's nothing moderate about them. They're neo-statists. They're contributing to the nation's decline. And so are their cheerleaders in the media, such as it is. Extreme right wing of their party. Well, what do I expect? What do we expect? When Obama views the framers as nothing more than slaveholders. When he has no respect for the Constitution he swore to uphold. What do you expect? I read somewhere that Obama has himself unilaterally changed Obamacare 17 times. President of the United States doesn't have the power to change a statute one time, let alone 17 times. But he did it. And when Richard Nixon sought to impound funds, that is, to refuse to spend funds appropriated by Congress, and there was certainly a colorable constitutional argument that he had that power, that was one of the articles that they were drawing up of impeachment against him. Meanwhile, Obama, not once but 17 times, changes a statute. But Congress can't even do it once. Well, it's the law. It's the law. He changed it 17 times. I want a clean continuing resolution. Who gives a damn what you want? You're one man. You're a temporary president of the United States. You don't get to impose your will on the whole of the nation. You get to follow the Constitution. That's why I'm so sick and tired of these people who say, including John McCain. Well, he won the election, didn't he? Yes, he did, John. But the Constitution wasn't up for election. It never is. And it's the responsibility of the other branches to make sure a president who doesn't comply with the Constitution is addressed in one way or another. He's either honed in, his decisions are overturned, or what have you. The moderates in the Republican Party, the realists, the smart ones in the Republican, they're not the extreme, wing of the Republican Party. This from Obama, who has spent his entire life immersed in radicalism. All right, let's move on to cut 20 today from Obama. He didn't take a single question. But what's the point? What would the Praetorian Guard ask him anyway? Hey, what do you think of those Republicans shutting down the government, Mr. President? Well, I'm glad you asked me that question. Cut 20, go.
Some of them may be sick as we speak. And this is their best opportunity to get some security and some relief.
All right, let's stop. Let's stop right there. So there's Obama positioning Obamacare as giving health care to the sick and needy who wouldn't have it but for Obamacare. Well, what's Medicare? Well, that doesn't count anymore. We're moving. It's new. We're transforming. And yet, caller after caller after caller, what Obama has done to them, like Mary in New Jersey, the great WABC. Go.
Hi, I'm affected Thank you for taking my call. I'm affected in two ways. I work in the healthcare system, and we're seeing a lot of less inpatients. So now I'm being asked to take call instead of working my 36 hours a week. I'm asked to take 12 hours off and get only paid $3 an hour, waiting for them to call me in. So that's affecting my income and also my coworkers, because we do it on a rotation cycle. And
are you a millionaire or a billionaire, my friend?
Neither.
Are you an extreme right-winger in the Republican Party?
No.
Are you, well, you know, the usual propaganda. All right, I'm sorry, Mary, that you have to go through this. God bless you, my friend. I really am. I don't care about lying, too. I know what this jerk, Senator Angus King. Oh, wow, an independent, they say. A whack job, a jerk. That's right, Angus. And who the hell names their kid after a cow, Mr. Producer? Angus? The hell is that? Child abuse. Obviously, it's affected the man. Marie, New York, the great WABC. Go.
Hi, I just want to say that no one's been denied health care, that they might be denied the facility that it's being given at, but no one's denied health care. I work in a health care facility. Second of all, us in the health care facility...
All right, slow down. Whoa. This is an important point. Nobody is denied health care. And to a great extent, you're correct. Even illegal aliens can walk right into an emergency room and get health care.
Correct. So there's no such thing as anyone ever being denied health care. Now, if you're sitting there and you have something that's non-emergency, you might be saying, well, you know what, we'd love to help you, but you can go down to a clinic. We're a private facility, but the clinic down the street that accepts...
No, not unless all of us have to go to the clinic. You see, this is Obamacare. All of us get to go to the clinic, even if we choose to purchase... even if we work, save the money, contribute to a different plan, that's not fair. So we're all going to go to the clinic. We're all going to be on state exchanges. We're all going to follow the government's dictate. And the IRS is going to enforce it. That's the mob rule there, the strong-arming. So it's all going to be swell.
Right, but when they were saying is that people are denied health care, that's not true. No one is ever denied health care. If you are having a heart attack...
Now, I know, but you mean... Hold on, ma'am. Slow down a second. You're talking about emergency care, and that's true. But there's no question people are denied procedures and so forth sometimes, and that's okay. Maybe they should be. You're quite right about emergencies. But I'm going to have callers say, well, I was denied this coverage and that. Yes, that does happen. And, more than any insurance company prior to all this Obamacare stuff, Medicare denied more people benefits and so forth than any insurance company. We talked about that at the time. Doesn't matter. No, Obama's going to fix it all. Got a cult of personality going on here. Everybody's got their theories and their arguments, why Obama gets it. It's simple. It's called a cult of personality. And when you have a cult of personality, the guy can do no wrong. That's why things don't stick to him. The guy can do no wrong because he's more important than the country. He's more important than your health care. So in other words, they're praying to a false idol named Obama. That's what's going on. A cult of personality. Jack, Phoenix, Arizona, XM Satellite. Quickly, go, sir.
Yes, Mark, first-time listener, and I just wanted to make a comment. I'm retired Army, served 23 years, recently broke my wrist. Now, I'm on the government's health care, TRICARE, been on TRICARE all the time, never had to go in to get really treated. Of all the 40 providers in the Phoenix area that do hand surgery, none of them are accepting TRICARE. Now, I asked them the reason why, and they said because of the recent changes, and it's the way the government is reimbursing, they're dictating to these providers how much they're going to pay them, and because of Obamacare. The only way I got my treatment was I had to get on my wife's Blue Cross Blue Shield. So my TRICARE is worthless because of Obamacare.
Isn't that amazing? Now, TRICARE, that's related to the military, correct?
That's correct. That's the TRICARE Prime. When you retire, you can, opt into TRICARE Prime, and, that was our promised health care for our service.
And, I finally asked one of the providers, I said, can you please give me the straight scoop? Why are all of these providers that are on the government website, they're listed on the government website that they accept TRICARE, but when you go to see them, they say, we do not accept it. They said it's because of Obamacare.
Jack, I'm going to tell you something, my friend, and thank you for your service. Let me tell you, this administration, these Democrats, they are lucky that people aren't marching on Washington like they did after World War I. The vets, they are lucky that people in this country are well behaved and civil. They are just very, very lucky. Because the way you just listen to the callers to this program, ladies and gentlemen, and many of you who are adversely affected by this Obamacare is a cancer in so many respects. And it's eating through our society. Surely it is.